Hi, my name is Caroline Austin. I'm majoring in aerospace engineering, and I'm working with Dr. Martelli in the mechanical engineering department. Our project focuses on the biomechanical assessment of balance in response to external perturbations. Every year, 1 in 4 adults over the age of 65 will have a fall, and 1 in 5 of these falls will result in serious injury or death. While these current numbers seem harsh, they're anticipated to double in the next 10 years, rising from 3 deaths an hour to 7, as seen in the graphic to the right. Fear of falling also poses a serious health concern, as elderly people may reduce their physical and social involvements, increasing their mental and physical decline and increasing their risk for falls. In response to this crisis, my lab has the 3-part goals of first, improving methods of identifying those at risk for falling, second, improving stability in these high-risk populations, and third, designing assistive balance devices to be used in the everyday. So how do we maintain our balance? The brain uses 3 main sources of input to maintain stability. The first of these is visual. This is the most straightforward. The brain uses feedback from our eyes. Second is vestibular, and this comes from the fluids in our ears and the pressures that they exert when we move our head. Third is proprioceptive, and this is basically just feedback from our central nervous system. Because these are the 3 sources of input that our brain uses, any balance disorder is going to adversely affect 1 or more of these 3 systems. Conversely, if we want to improve balance, we're going to target one of these 3 systems. My research focuses on improving proprioceptive feedback, and we do so through the use of a technology known as stochastic resonance. Stochastic resonance uses low-level random vibrations to enhance the perception of a more prominent signal. This may seem counterintuitive at first, as often we think of a nice clear signal like this top plot as being the easiest to perceive. However, when we introduce these random low-level vibrations, we can add these 2 together, increasing the amplitude of the more prominent signal and making it easier to feel. In terms of balance, this would be applying these vibrations to the feet, which makes it easier for the brain to sense and respond to a shift in weight. Previous studies have shown that stochastic resonance is effective in improving balance. However, these studies have focused on elderly populations and in basic quiet stance or still standing trials. There has been no definitive improvement in younger populations, so we'd like to look at these younger populations and introducing perturbations or disturbances into the balance and seeing how stochastic resonance will affect that. And we expect that by increasing the difficulty of maintaining balance, we will see that improvement due to stochastic resonance. Another reason we are looking at these perturbations is because when we fall, you're not going to fall just standing still. There's going to be some disturbance that initiates the act of falling. So by gaining a greater knowledge of how stochastic resonance works in these high difficulty balance situations, we'll have a better idea of how to apply stochastic resonance in everyday life. Next, I'd like to talk about the composition of our data set. Our data was collected at Columbia University, and each of our participants was asked to participate in 16 trials, 2 1-second calibration trials, and then 7 different combinations of perturbation and non-perturbations, which are illustrated in the graphic to the right. Taking a little bit closer of a look at what these combinations were, surface perturbations refers to the treadmill on which our participants was standing on, moving forwards and backwards randomly throughout the trial. And then visual perturbations were applied in our virtual reality environment where an artificial swaying motion was induced. And then looking at this last image here on the bottom left, that is an image of the apparatus we used to apply the vibrations to the feet. There are 3 motors which applied the random vibrations. Each trial lasted 50 seconds, and our participants were asked to stand as still as possible. I'd also like to note that the vibrations were applied at 90% of the sensory threshold, so our participants were unable to feel the vibrations, and then we chose 90% due to its optimal results shown in a previous study. Data analysis has been my greatest role in the project. I've been working on developing a software package which runs the appropriate calculations and generates corresponding plots. Most measures of balance that we use are going to be derived from either the center of pressure or the center of mass, and there's a slight difference between the two. The center of pressure refers to the location of the reaction force of the participant's weight, and the center of mass is located in the pelvic region. Because the center of mass is located higher up on the body, it's going to move around a little bit less than the center of pressure, and we can see that illustrated in our stabilogram here to the right. Each of the lines in the stabilogram represents the location of the center of pressure or the center of mass throughout the trial. And then if we look at the axes here, anterior posterior refers to forwards and backwards movement, whereas medial lateral refers to right to left. So if we look at these scribbles, if you will, a more compact scribble indicates greater stability. And this is a good qualitative way to look at balance. So if we start with our stochastic resonance trial here, we can see that yes, it's a little bit tighter of a scribble than on the right here where we have our non-stochastic resonance trial. So again, qualitatively, this is just a good way to see that yes, stochastic resonance is causing our participants' balance to behave as we expect it to. Now I'd like to highlight some of our most interesting quantitative results, and these are from our most difficult trial. So this was the treadmill was moving back and forth randomly, and our participants were asked to have their eyes closed. We have a series of box plots here for some of our parameters we use to measure balance. The red line will indicate the mean of all of our subjects who went, and for all the variables we'll look at, a lower average indicates greater stability. Starting off with the planar deviation, this is a measure of the deviation from the average center of pressure location. We can see stochastic resonance has that lower average, and if we then look at our p-value, which we use to help us determine whether or not our results are meaningful or not, we have a p-value of below 0.05, which indicates that yes, our results are significant. Moving to the phase plane parameter, it's very similar to planar deviation. However, it also accounts for deviations from the mean velocity. Again, we see stochastic resonance does show improvement. However, if we look at our p-value, it is above 0.05, indicating that these results are not significant. However, at 0.07, it's very close to 0.05, and because we had a sample size of only 7 participants, we believe if we ran more trials that this p-value would lower and these results would become more significant. On this slide, we have the center of pressure path length. So if we think back to the stabilogram on slide 7, this is just the length of that line, except for in this case, we're only looking at the forwards and backwards movement. And that's because most sway happens in the forwards and backwards direction, and you can see that illustrated on the diagram to the right. Again, stochastic resonance has that lower average. We have a significant p-value. So overall, our results did show that by increasing the difficulty of maintaining balance, we did see improvement in these younger populations. Looking into the future, there's still a few more parameters we'd like to integrate into our software package before we move forward and attempt a very similar study using electrical white noise rather than mechanical white noise. And so in this case, we would apply electrodes to the bottom of the feet rather than motors, and they would apply electrical signals. For this study, we'd like to have a larger sample population to increase the reliability and the generability of our results. Outside the current scope of our project, we'd like to explore applications in dynamic balance cases, such as walking. And of course, if we want to fully utilize this technology, we'll have to start developing wearable devices that can apply stochastic resonance in the everyday. Thank you all for your attention, and with that, are there any questions?
How do you accurately measure and record the center of pressure and center of mass?
That's a great question. So again, center of pressure is the location of the reaction force of the participant's weight, and the center of mass is located in the pelvic region. So the center of pressure is located using force plate data. We have a force plate for the right half and the left half, and we take a weighted average of the locations there. And then for the center of mass, we use marker data to help us estimate the location of the center of mass. So we can use markers located on the hips and the lower back at each point in time to estimate that location. And we estimate the center of mass as the centroid of the pelvic region.
Why are you applying the vibrations below the subject's ability to feel them? What would happen if you increase the vibrations so that they could feel them?
So we are applying the vibrations below the sensory threshold because if they were able to feel them, it would begin to interfere with the perception of that shift in weight, of that more prominent signal. So rather than adding and increasing the amplitude of the shift in weight signal, it would detract from it and start to be its own signal.
Did you also consider looking for improvements in the sideways direction, not just forwards and backwards?
Yes, so as I said, we looked at the forwards and backwards direction for most of our parameters. And again, that's because most sway happens in the forwards and backwards direction. But there is sway that occurs in the right and left. It's just less. And so we did look at the parameters in the right and left directions as well as a resultant direction as a combination of forwards, backwards, and right to left. However, the forwards and backwards direction was the only place with significant parameters and significant results.